Welcome to the next section of ophthalmology, ocular surface disease. In the next 10 minutes, you'll have a review on what ocular surface disease is, a quick checklist of signs and symptoms, a short list of predisposed breeds, some facts and fictions about tears, then the what, why, and how management of a dry eye. Ocular surface diseases are disorders comprising the cornea, conjunctiva, eyelids, and lacrimal glands. The cornea is the transparent layer that forms the clear dome at the front of the eye. Tears are made in part from the lacrimal glands. Some signs and symptoms you may notice would be red eyes, frequent rubbing of the eye area with paws, watery eyes, tearing and tear staining of the fur around eyes, accumulation of secretions and debris on the eyelashes, eyelids, and lid margins, and evidence of pain or soreness near the animal's eyes when you try to clean them. You want to diagnose and manage ocular surface disease early. Just like cataracts can cause blindness, as seen in this Labrador, ocular surface disease in the Shih Tzu can seriously impact eyesight and quality of life. Have you ever been asked if dogs cry? Dogs don't have emotional tears. They can show distress in other ways. They do have basal tears and reflex tears. Reflex tears are in response to irritation, like you or I have when we are chopping onions. Tears are vitally important in helping to keep the cornea healthy. Without tears, eyes become irritated. The conjunctival tissues around the eyes get red. The cornea itself, in time, will turn brown in an effort to protect the eye, and a gooey yellow discharge predominates. Blindness can result. Did you know tears contain more than water? Tears consist mostly of water, but also of oil and mucus secreted from respective glands in the eyelids and conjunctiva. The water portion of tears is secreted by two lacrimal glands in dogs and cats. One gland is just above the eye, and the other is in the third eyelid. Tears drain down the nasolacrimal duct that exits in the nose. Tears are triple-layered, high-tech lubricants. The oily outer layer prevents evaporation. The watery middle layer is lubrication, and the mucus innermost layer helps the tear film spread across the cornea. When you blink, the eyelids act as windshield wipers to spread the tears across the cornea so it is evenly coated. Dogs and cats also use their third eyelid. There must be a proper combination of tear production and spreading to allow the cornea to remain clear and healthy. Tears have multiple jobs to keep those corneas pristine. They contain antibacterial proteins and salts and serve to flush away the irritants and infectious agents that are constantly getting in our eyes. Since the outer portions of the eye do not have a blood supply to bring nutrients and remove metabolic waste, it is up to the tears to provide these services. Multiple different factors can cause abnormal tear production or distribution, anything from allergies or infections to the environment or a genetic predisposition or something like radiation therapy. Keratoconjunctivitis sicca, or KCS deconstructed. Kerato refers to the cornea or clear dome of the eye. Conjunctivae are the moist pink membranes of the eye socket. Itis means inflammation, and sicca means dry. KCS or dry eye means there is an inflamed, dry cornea and conjunctiva. Dry eye occurs when there is a deficiency in the water portion of the tear film, which normally accounts for 95% of tear volume. Without the water layer, one is left with oil and mucus, hence the gooey yellow eye discharge characteristic of dry eye. The top two reasons for dry eye in dogs are anesthesia, which will reduce tear function temporarily, which is why all eyes must be lubricated with ointment for every procedure, and immune-mediated destruction of the tear-producing gland tissue. We do not know what causes this type of inflammatory reaction, but several breeds are predisposed. This includes American and English Cocker Spaniels, Springer Spaniels, miniature Schnauzers, West Highland White Terriers, and Cavalier King Charles Spaniels. KCS in cats, is it common, uncommon, or rare? KCS is considered rare in cats. In cats, herpes upper respiratory infection can lead to a chronic dry eye. This may be due to tear duct occlusion and inflammation, along with viral damage to the mucin-producing glands in the conjunctiva. Because KCS is less often immune-mediated, this impacts treatment decisions. So let's repeat. You want to diagnose and manage KCS early. Just like cataracts, KCS can seriously impact an animal's eyesight and quality of life. Immune-mediated KCS results in the loss of the tear production. The cornea is deprived of oxygen and nutrients. Debris accumulation and bacterial overgrowth cause inflammation and irritation. The cornea loses its shine, can look irregular and ulcerate. The conjunctiva become red, squinting, and pain is evident. Depending on the severity, blood vessels and pigment can be seen on the cornea, along with inflammation of the eyelids and skin around the eyes. So how do you avoid missing the diagnosis of KCS? Any patient with ocular surface inflammation, discharge, or corneal opacification should undergo a tear test. If this step is skipped, many cases of KCS will go undiagnosed or untreated. iMed Animal Health is focused on providing veterinary professionals with the most innovative and effective products at an affordable price. A red eye needs a tear test. When a patient presents to you with advanced KCS, the diagnosis may be pretty obvious, but early on in the course of the disease, it may look like a simple case of conjunctivitis. In either case, it is important to measure the tear production to determine how dry the eyes are. The test that accomplishes this is called a tear test. It is critical to follow the instructions very closely and ensure that you're not touching any of the portion of the tear test that will be going into the animal's eyes. We will have a video on our PVS education website to show how a tear test is best conducted. Treatment objectives for dry eye include eliminating the cause if it's possible, stimulate tear production, replace tear film, control and prevent secondary infection, and reduce inflammation. There are some treatment essentials for immune-mediated KCS. Immune-modulating medication increases tear production, decreases inflammation, and decreases pigmentation. Topical cyclosporin impacts immune cell function and directly stimulates tear production. It needs 4 to 6 weeks for maximum effect. Topical tacrolimus works in a similar mechanism to cyclosporin, but it's much more potent. It's reserved for dogs not responding to cyclosporin as there is no commercial product. Tacrolimus must be formulated from a reputable compounding pharmacy. There is also a surgical procedure called parotid duct transposition that's a potential solution to unresponsive severe KCS. It's a very delicate procedure performed by a veterinary ophthalmologist. Eye lubrication is critical for all of these cases. When thinking about eye lubricants, viscosity is important. Aqueous-based products will have limited use due to the short duration of action versus other more viscous gels. Treatment frequency will depend in part on viscosity. Advanced products contain sodium hyaluronate with enhanced viscoelastic properties to mimic tears. Lubrication will be needed hand in hand with cyclosporin treatment, particularly in the early stages of treatment. Prognosis and easing worries. Dogs with low tear test results still have an 80% chance of responding to cyclosporin. This medication has truly been a miraculous breakthrough in the treatment of KCS. How can you go that extra mile in helping your clients care for their pets? With the most common cause of KCS being immune-mediated, owners need to know therapy will be lifelong, and initially, lubrication could be every couple of hours. Healthy treat options in association with medication can maintain that trust and bond. Take the time to calculate acceptable daily treat calories to make it easier. What's up next, you ask? KCS is a common cause of corneal ulceration in dogs. Move on to our next segment for more 10-minute takeaways on corneal ulcers.